Hi, I'm Dr. Josef Witt-Doerring, a board-certified psychiatrist specializing in identifying and treating psychiatric adverse drug reactions. Today I'm speaking with Marsha, a mother who developed severe akathisia after taking just 2 pills of Lunesta, otherwise known as azopiclone. This is a trigger warning. This video contains discussions about suicidal thoughts and severe adverse reactions to medications. Suicidal thoughts and behaviors are commonly seen in akathisia due to the significant mental and physical suffering it causes. Marsha will share her compelling story beginning with the onset of akathisia symptoms after her initial dose of Lunesta. Lunesta is part of a class of medications known as Z-drugs or hypnotics. Unlike the benzodiazepines, Z-drugs have a different structure, shorter half-lives, and interact with a different part of the GABA receptor. They act as GABA agonists, mimicking your neurotransmitter to induce sleep. Following the development of akathisia, Marsha experienced misdiagnosis and hasty alterations to her medical regimen, which only intensified her suffering. In the end, Marsha took control of her care, trusting her instincts that it was the medication causing her distress. By eliminating the toxicity from her body, she embarked on a journey of healing. Since this traumatic event 3 years ago, Marsha has made remarkable strides in her recovery. In an effort to put the risk of akathisia into perspective, I reviewed the drug label to provide some data on the incidence of akathisia. However, it is not listed as a common side effect with any numerical data provided. There are many neurological side effects listed as infrequent, defined as occurring in fewer than 1 in 100 and at least 1 in 1,000 patients, including agitation and insomnia, but no mention of akathisia. I feel like akathisia is under-recognized, as we'll hear in Marsha's case, and understudied, and so there's unfortunately not sufficient data to tell you how common it is in regards to Lunesta. Marsha will mention her organic acid test showing some abnormalities, which may have influenced her vulnerability to developing akathisia so quickly. Organic acids are products of the body's metabolic pathways. The organic acid test provides insight into nutritional and metabolic status, including neurotransmitter function. We can delve into this topic in greater detail in the future, but I want to highlight the importance of considering functional medicine if you're experiencing an adverse reaction to a medicine. Identifying vulnerable areas through testing can be addressed with appropriate supplementation or treatment. But for now, let's go on and hear Marsha's story about how this all started. Hi, I'm Dr. Josef Witt-Doerring. It is my pleasure to speak with Marsha today, and she's going to be sharing a story about a drug injury with zopiclone, or Lunesta is the brand name in the US. I haven't covered this drug before, but it is similar to the benzodiazepines. And so, Marsha, I'm excited to share your important story. So, welcome to the show.
Thank you.
Yeah.
Thank you for having me.
No problem. So I think a nice place to get started is tell us what was going on in your life to have you take zopiclone or Lunesta in the first place?
I think after my pregnancy, I started to have problems with sleeping. That turned out to be that the pregnancy induced hyperthyroid issue.
Mm-hmm.
And after that, actually I felt normal again. Like I felt great in the mind. I didn't have any mental symptoms, but my body was having issues. I was having sleep issues. I was feeling more weak than normal, but I was doing fine. Like it's not that I couldn't function or anything. I could go out. I could go take my child to school on the bike, and everything was sort of okay. But I always was having complaints. And then at one point I started some B vitamins. That was in the summer of 2021. So I took those B vitamins and I felt that I was having more energy. I felt more peaceful. I slept better and everything went actually better in my life. Mm-hmm. And then at one point I started to have some symptoms and people told me, yeah, maybe you're B6. You're taking too much of the vitamin B6. They can give you some strange symptoms, you know. So I quit the B vitamins. And from that moment on, I had so much trouble sleeping after quitting those vitamins that at one point I was sleeping for like 2, 3, maximum 4 hours for weeks. And I went to my mom and she said, well, maybe you should take some of these sleeping pills. I take them daily and for me it's not a problem, right? Mm-hmm. So I tried only one on Friday evening, like in November, the first week of November, I think, 2021. And immediately I felt strange. I remember that I wrote my friend, like, Jesus, I feel so restless. I don't know what these pills do, or maybe I'm just restless. I don't know. And I was thinking maybe my thyroid is acting up again that in those days. And then next day, but I slept 6 hours. So I was like, okay, I slept 6 hours. That's great. And then the next day I took another one, and I felt wrong. Like even more than the day before. I felt so restless and strange, and I wanted to go home. So I went home. I took the taxi home, and I was like, geez, my legs, they don't feel normal, you know? So I called after like 4 hours of feeling completely like shit. I called an ambulance because my left side was doing a strange thing. It felt like I experienced a stroke. So I called the ambulance, and then those people came to my home, and they said, no, it's not, it's nothing. You're not experiencing a stroke. It sounds more like some neurological stuff. And then because I didn't think about those pills, and because I was busy with those B vitamins, which I quitted like a month before, I was thinking maybe I do need something in those B vitamins, because it's so strange how I feel now. But I just leave it like that. I never took the Zopiclone anymore. And every day from that moment on, my life was changing already after 2 pills. And I was thinking like, what happened? What happened? But I never thought about those pills. So I thought, okay, I should start those B vitamins again, because I think this is what's going on with me. I need those B vitamins. So I started to take those B vitamins again, but it made everything worse. While in the first place, like a few months ago, they were making me better. So suddenly I couldn't tolerate them anymore. I could not have any B vitamin. Then my sleep was so terrible that I was so anxious suddenly, and I never had that. I was familiar with feeling restless, because that's also a sign of a hyperthyroid. But I felt anxious. When I was watching TV, and everything felt like creepy and spooky to me. Even the most normal things, even looking at a flower, was giving me sort of a anxious feeling. And then my friend said, "Hey, Marsha, there's something going on. Maybe isn't it trauma? Don't you have that a lot happened in your life? Like you divorced with your man when your child was only 1. Your father died. This and that." But I said, no. My father died years ago. That's already like I'm healed inside from that happening. And she said, well, maybe you should take something to sleep better, because if you don't sleep, you're going to get ill. Everyone who doesn't sleep is going to get sick eventually. So she called my doctor, and she said, hey, I'm calling for Marsha. And to be honest, I think she should go on a sleeping pill, because she's not sleeping at all. And my doc said, yeah, perfectly fine. That's okay. Here you have a prescription of Zolpidem. Then they gave me Zolpidem. And the first day I took it, I slept finally for like 3.5 hours. The second day it didn't work anymore. Fourth day I took it, nothing. Sixth day I took it, nothing. And at this point, I was in a chronic state of panic. And I couldn't function. I couldn't sleep, nothing. My left side of the body, let's say my left lung, it felt like it didn't communicate with my brain. So I was all the time gasping for air suddenly.
Wow.
So people said, yeah, you should breathe better. It's you're just hyperventilating. This is not a breathing issue. You're not a physical issue. You're doing this yourself. I said, no, I'm not doing this myself. I have problems breathing with my left lung. So I took another a couple of those zolpidem, and then suddenly I took it. Felt normal for 2 hours, and afterwards I was in a severe state. I felt suicidal. I thought, what is going on? I never in my life felt suicidal before. I'm not that kind of person. I'm mostly a happy person, right? So, and it felt like as if I was below the water and everyone was on the above the surface, right? As if I was somewhere drowning and drowning and drowning. I didn't hear clear. Everything was like, I'm just not here, and everyone is somewhere in another dimension and no one is hearing me. Then I called my mom. She was on holiday. I said, you have to come back. I can't take care of my child in this position. This is not normal anymore. I'm so afraid and I feel so strange. I'm not here anymore. And then she came back from her holiday because she heard that I was serious. And then she said, well, maybe if you don't sleep, take those Zopiclone, because apparently the zolpidem is not working, because the half-life of the zolpidem is like 2.5 hours, and of Zopiclone it's like 5 or 6 hours. So I started Zopiclone from my mom, spoke to my doctor, told her what I'm going to do, and she wrote me a prescription. And from that on, literally my whole world turned upside down. I was not able to talk anymore normally. I couldn't be alone anymore. My child had to leave. I couldn't take care of her. My mom, she lived at my place for, I think, like 10 weeks or something to take care of me and her. But nothing changed. And now looking back, she said, every day I saw you getting worse and worse and worse. Then I think this happened. I restarted the zolpidem in February. I quitted them cold turkey in March after 7 weeks of use, with the Zopiclone also included. After that cold turkey, all hell broke loose. I developed severe akathisia. I couldn't stop pacing. I was pacing all day. My child was, even though my child was still living with me, she was like following me. She was 4 years old back then. And she was like following me in the house, like, hey, come we to run circles with mommy. For her, it was funny. For me, I was in a complete hell. But I never heard of akathisia. Like, what is akathisia? You don't know anything about it, right? So, but then all people around me were telling me, well, you're mentally ill. You are mentally ill. This is not possible from short time on these benzodiazepines. It's not possible. And I told them, it's a medication, I'm sure. And then they said, yeah, sorry, Marsha, but they were sort of nice in the beginning, the people around me, like, hey, but you've been through a lot. You always stood strong. Maybe now your body just gives up. And I said, no, my body doesn't give up, because I'm a positive, strong person. This is not me, what's happening. I'm feeling neurological shit going on, which has nothing to do with my mental state. My mental state, I don't know why I am like this. And from there, actually, from the cold turkey, it was such a big mess that for me, I don't remember fully what happened. It was one big mess. The only thing I do remember is that I was crying all day long, pacing, screaming, and begging my father, who died already 10 years ago, like, please come get me. Please come get me. I need to die now. I can't anymore. I went into psych wards. They wanted to, because I kept on telling them, this all started with those B vitamins, which I quitted, and then I started this medication, and then all hell broke loose. So in that psych ward, they also had some neurological doctors who took a look at me, and they were like, yeah, we don't know what's wrong with you. You're perfectly fine. But I couldn't even walk anymore. I couldn't even stand on my legs. So people had to carry me, or I needed a wheelchair to go around. And they wanted me to participate in those group sessions there, but I couldn't leave my bedroom. I couldn't even stand up. I couldn't have people around me. I couldn't handle people talking to me. I couldn't handle anything. So I called a friend of mine and I said, I want to leave this place. I don't want to be in this psych ward. I don't belong here. People here are completely out of their mind. I don't know what's going on with them. I just need a dark room and a quiet place and no one around me. And I needed to cry and scream. Sometimes I was not screaming full day, of course, but I had these episodes that the Akathisia would act up extreme and then I would cry, and so I said, you have to come pick me up. So he did. And they didn't want to let me go. So I had this conversation with the psychiatrist there and she was looking at me. And I told her, I don't know what's wrong with me. I really have no idea what's wrong with me, but I was never like this. And I always was normal mentally. I never had mental issues in my life. And now I'm just scared and I feel like as if I'm trapped in a hell. And she said, you shouldn't leave because we saw you and you have a very severe mental illness going on. And we really need to have you here because you are a danger for yourself. I said, yes, I am a danger for myself, but it's not me. It's something else. It must be the pills or whatever. But I was so confused that I couldn't even stand up for myself and tell them, hey, this is because of the pills. Because it sounded also to me so not logic to be so extremely ill from a benzodiazepines I only used for like maybe 2 months. But my friend, he came and we had a talk with that psychiatrist and he told also the woman, like, she was never like this. She's like this since a couple of weeks. But no one there thought, oh, maybe it's the pills, And then I left. I went home. And eventually they wrote it the psychiatric, let's say, institute in my neighborhood. They would come and check on me. 2 weeks later or something, they were there. They came here with 2 nurses, a psychiatrist and a psychologist. And the only thing I told them is, I want to die. And I'm going to kill myself. No matter what. I'm going to do it. If you're not helping me, I will do it myself. I want to do, how do you say this? Euthanasia?
Yes, just like that.
Yeah. And then I said, and I didn't sleep for like months. I didn't sleep for months. I need to sleep, I told her. If I don't sleep, I get even more crazy. So she put me back on Zopiclone. That was like, I think this period was like 2.5 months after the cold turkey, after short-term use. She put me back and I started to sleep like 3 hours, 4 hours instead of no sleep. And from that period on, I don't know what happened. I don't remember. I only remember like some images of moments. I didn't leave the room I am in now because I still prefer to be in the dark most of the time if it's possible. I was here for like a year. Didn't leave my bedroom. Couldn't walk. The only moment I could walk was in the night when I took the Zopiclone again. I could walk for like a few hours, for 2 or 3 hours. And then after that, my legs would stop working again. My ex-boyfriend, I called him. He came here. He took care of me for like 8 months. If he wasn't there, I would be dead 100% sure. Because I was begging him every day to please kill me. Please kill me. I can't anymore. Then I decided I need to get off this medication. At one point, I started, after the reinstatement, I was still very bad with the akathisia, but I could think a little bit more clear the moments that I took it. At night, around 11, I took them, or 12, and then after 1 or 2 hours, I was sort of able to think a little bit. And I started to make a plan, like, okay, I should get off this medication. But I had no idea about anything still. So I just cut those pills in 6 pieces. And I was like, okay, the first week I will take 1/6 of the pill. Second week, the other part. And then in 6 weeks, I will be off. I miss a lot of things in this story because it just is too much. Because now I'm saying this, I'm also remembering that at one point I started to take 2 Zopiclons a day. Because then my akathisia would be a little bit better, But I had I was so stupid. I was so utterly stupid. I couldn't even, if you would tell me like, hey, what is 4 plus 5 plus 13 plus 10, I would stare at you and think like, what the fuck are you asking me? I have no idea what you're asking me. I don't know. Like I couldn't even have my child anymore. She was not in my house. I raised her. She always lived with me. She slept with me in my bed every day for the past 4.5, 5 years. And suddenly she was gone. And if I saw her, I was scared of her. I couldn't look her in the eyes because if her pupils would widen, then only the color black in her eyes made me feel like this is some work of Satan or something. Everything was satanic. Everything was horror. Everything was impossible to understand. I didn't even know how I had to make myself a tea, for example. I couldn't process those things. So my ex-boyfriend was there to take care of me. And at one point, when I tapered off like half of the tablet myself with breaking these tablets, and then I was stuck. I realized I can't do it again like this because those last 5 milligrams they're equal to 5 milligrams of Valium, the last half one. I started to have seizures when I would lower them. I was shaking all day. I was stuttering. I had severe dystonic attacks. My arm was like stuck on my chest like this for hours a day. So I thought, if I continue like this, it's not going to work. So I called my psychiatrist and I said, I need to get off these pills and I want to have taper strips because I can't do it myself. I can't buy a scale and do those things, right? It's too complicated for my brain at the moment. So she ordered me taper strips. And I went off the last 5 milligrams of Valium equal to it. It's I think it was 3.8 Zopiclon. I get off of them in 12 weeks. Still, it was too fast for me. But okay. I went off. It was one big hell. I think I had 150 symptoms, and I'm not exaggerating. And then the moment I jumped, I felt, hey, I can think. I can think a little bit more straight, So I called my ex. I want my daughter back. I'm okay. I think I'm okay. But it was just the first 5 minutes after more than a year of not being able to think. It was the first 5 minutes that I was sort of able to think normal. And then the next day, everything started over again. But my akathisia, which was really severe, I think it lessened for 50% when I took my last 0.1 point whatever of Zopiclone. So for me, the Zopiclone, the Akathisia, I have the feeling that it's that it was. The question is, was it a paradoxal response, acute, that November 2021, or did it do something to my brain? Well, and I was in acute tolerance. Nobody knows this. Nobody knows this. I think, and this is what I told you before we started the video, I think there are lab works from the Great Plains Laboratory. It's a lab in Europe and America. They analyzed my organic acid test and they saw that there are problems with my pyridoxine metabolism, the vitamin B6. Vitamin B6 is the vitamin one needs to produce enough GABA in the body and the brain. And I think it has to do with this underlying thing that I was in acute tolerance or an acute paradoxal response. I don't know. My dystonia in my mouth and tongue happened already the first week on them. So not when I was cold turkeyed.
Yeah. I totally understand that. I mean, it sounds like how could it, almost like being in a state of disbelief. How could this happen so quickly?
Yeah.
There must be an underlying vulnerability.
Yeah.
Yeah.
I think there is an underlying vulnerability, but I don't think anything else in the world can do so much harm to a person than these kind of medications.
Mm-hmm.
Without them, I would be okay.
Marsha, for a long time, I used to think that this could only happen to people who had been on the drug for years and then they come off rapidly. But I mean, just personally in my practice recently, I've seen a number of women with who were started on benzodiazepines for perimenopausal insomnia and anxiety. And just within a period of a couple of months, they've developed full-blown symptoms, whatever we want to call it, tolerance withdrawal, but what I think when I see it, I see just neurological damage. I've also worked with a gentleman recently who took Xanax for about half a year and developed full-blown neuropathy, burning in his feet, ear ringing. And for reasons I don't understand, this can happen quite quickly with these medications. I don't hear stories as I haven't heard a lot of stories as severe as yours, where it's like you took like 2 of them and then it was like really bad, and then every time you took it, it seemed to like make it worse and worse and worse. But I believe it because to me, there's no reason why that couldn't happen. And is it because of the B12, or is it an unknown vulnerability? I mean, there must be something that caused you to have such a severe adverse reaction with just a few doses.
Well, the thing is, I was visiting my doctor after my pregnancy, that I was having symptoms, and I was sure that I was lacking something like vitamins. And then I came to her with this Great Plains organic acid test, which is analyzed by a well-known scientist who was working on these things already for 30 years in her life. And I was telling them like, hey, there's something wrong with me, because I feel that there's something going on with my nerves sometimes, but it just didn't make me disabled or anything. It was just a sensitivity, and I always needed to up my potassium. For example, if I didn't eat enough potassium, I would have cramps very, very quick. Like everyone with a lack of potassium has cramps. But normal people can live longer without enough potassium than me. For example, if I wouldn't have my coconut water or my grapefruits or whatever, I would feel cramping in my body. But it was not a neurological thing. It was an electrolyte thing, But I do believe that these kind of small signs are the signs that someone with my issue should never, ever take a benzodiazepine. Never.
And is your daughter back living with you now?
Yes, she came back like in the week I jumped, she was back.
Okay, great.
Yeah.
And have you had any improvement over the last 3 years since this all started?
A lot of improvements. Like mentally, I'm, let's say, 80% healed, maybe 90 even. But physically, it's still very bad. I also had COVID last January, and that made all my physical symptoms extreme, and even my akathisia, which was already gone for like 6 months or something, completely gone. Even my akathisia ramped up again with the COVID.
I have a patient that just happened to her as well.
Yeah.
And how have you been able to support yourself financially, just being so disabled?
Well, the moment when this all started, I was living here in this house. And let's say I don't know how you say this, alimentatie, when you get divorced or when you break up and the father pays for your child.
Yeah.
How is this called?
It's I guess maybe child support,
whatever
child support or alimony. I think sometimes
alimony.
Yeah.
I think that's the word. Like, and my ex has a great job and earns a lot of money, and he was like, okay, well, you just go live there. I will make sure that you and my daughter Fransje, that you guys can live there, and the rest, like all the other stuff like groceries and insurances is up to you. So this was his, because she was always with me. She was like 7 days a week with me. And we were great friends. We didn't had a terrible breakup, let's say. So, and he kept on supporting me.
Wow.
That's amazing. Like if he would drop me now completely, then I have a big problem. Of course, he also was one of the people who thought I was suddenly acutely mentally ill. So in the first place, he was saying, you have to leave that place. I'm not going to support you anymore, etc. But then after, when everyone around me saw that the moment I jumped off these pills, my akathisia was already like instantly 50% better. So everyone saw the difference. So they had no reason anymore to think, oh, probably Marsha is mentally ill,
Yeah.
Yeah.
Well, Marsha, I want to thank you for coming on and sharing your story with me. And I just want to ask, before we wrap up, is there anything else that we didn't touch on, or anything else that you want to share?
Well, there's a lot we didn't speak about, of course, because we are not going to discuss all these 150 symptoms. But I do know that, like, I had 150 symptoms. I think 100 of them left. So yes, we will get better. Do we heal fully? No, I don't believe it. Why? Because my whole posture has changed. My spine is damaged from all of this because of the weakness and the dystonia in the muscles. What I want and what I hope is that you, with your work, are making other doctors aware that this is just not an okay pill to take, that it can severely damage our brains. And that the whole "we all heal" mantra I don't want it. I don't want that mantra to be repeated all the time, because a lot of people are suffering in silence, and those people are 5 up to 10 years off. And it's not true that we all heal, but what is true is that we all get better and that it will never stay the same. And I do believe that mentally we all get better. Physically, like the bind is something else. And yeah, I don't know what your opinion is about that. I know I saw a video that you said if you're not recovered after 5 years, then maybe it's time to dig deeper. And I agree on that. But even if you have something underneath, doesn't mean the damage is reversible. That's my opinion.
Yeah, I think what you've said is correct. I think the majority of people heal. In fact, the vast majority of people will. I've seen tell me that they have a full recovery or maybe a near full recovery. But I mean, I can't tell you that. I don't know people who have been sick for 10 years. In fact, I work with them. Nicole Lamberson is one of my coaches, and she's still recovering. And it's been over 10 years for her, and she's a lot better than she used to be, but she still has symptoms.
Yeah.
And so, I mean, after 10 years, you have to think, there's damage there. And, I don't want to, she still says that every year that goes by, she feels a little bit better. And so it's just hard to know whether it becomes a full recovery or whether you essentially hit a plateau and it stops. But there is something to say about, I mean, you want to give people hope, and you want to tell them that most people recover, because you need to hear that when you're suffering. And that is true.
Definitely.
But there definitely are some people who will be sick for a very long time, and there is some uncertainty about whether they'll make it the full way there. But like you said, everyone does get better.
For sure. I do believe that too. Yeah.
All right. Thanks, Marsha.
Thank you.